New at 6 tonight, May is Mental Health Awareness Month. Increasing awareness often comes from educating the community about what resources are here to help. It also means shedding light on the side of mental health we don't normally see, like the things law enforcement face every day. That's a conversation that's important. Ethan Murray was shot and killed by Spokane County Sheriff's Deputy Joseph Wallace on Saturday. Deputy said Ethan was not listening to their commands and appeared to reach for something in his pocket. He was shot. No weapon was found. Ethan's mother told us on Tuesday that he was diagnosed with schizophrenia at age 19 and also suffered from paranoia. And she called for greater understanding and awareness of mental health problems. Our Caroline Rourke joins us now with more.
Aaron, working with members of this community who are in crisis is an inevitable part of the work that law enforcement and first responders do. They're not mental health professionals, but now they can bring one along with them, a tool the sheriff's office, the fire department, and as you'll see right here, the Spokane Police Department have all made use of. This may not be in their job description.
It's not up to us to determine what somebody particularly is suffering from.
But Spokane police officers are often first responders, the first to arrive when a member of our community is having a mental health crisis.
If you wait until the crisis is over and then 3 and 4 and 5 days later, it may look entirely different.
SPD is now better equipped to give immediate help. Almost all day and night on most weekdays, a Frontier behavioral health clinician rides along with an officer to intervene and to provide critical mental health help.
And you're still using police tactics, but you're doing it in a way that is kind of tailored towards a person in crisis if that's what's suspected of happening.
It helps people who struggle with mental illnesses by expanding their options.
And if you look at the two bookends, the stereotypical bookends, right? What do you do with somebody in crisis? Is it the hospital on one end and the jail on the other end? There's a gamut of things in between.
Of about 600 contacts, Sergeant Spearing says the diversion rate, the number of people who have not been sent to those traditional ends, is nearly 70%.
The dollar value alone tied to that number of people who have not gone to the hospital and incurred ER costs or not gone to jail and incurred incarceration costs is staggering.
It helps people in need and it lowers costs. But SPD says having mental health pros on hand is invaluable training for their officers. So when the clinicians aren't there, officers can still provide those tools.
Every resource that they utilize or turn that they take is also a learning experience if the officer hasn't experienced it. And then you just have this kind of a bleeding effect of this is what really works.
SPD says the ride-alongs were made possible by a grant secured by Frontier Behavioral Health. According to a press release sent earlier this year, the Spokane County Sheriff's Office had also received a grant to implement new mental health resources in the field. In studio, I'm Caroline Rourke, KXLY4 News.